Hi, Manisha Kerkar. I work as CHRO for Nuoco Vistas Corporation Limited. Wellness today is, I think, all the more important and most relevant as we move into from VUCA world to something called as BINA world, where employees are going to be your key differentiators in making your business really thrive. And the definition of wellness also is going to expand far beyond just the physical wellness of annual health checkups. I think the physical wellness, emotional wellness also in a way is coming, but I think along with emotional wellness, the financial well-being and the spiritual well-being will also play a very big role now in being overall looking at the employee health and wellness, because all the quotients really are integrated into one human being and work obviously in a very complex way, but still the definition of wellness we will see expanding into all these four elements and different offerings that we will have to give, because not one solution is not really going to work when it comes to financial and spiritual kind of areas. It's also emotional. So something very flexible yet which can be easy for people to use is what will be the need of hour, and I think that's what is going to make this whole area of employee wellness more challenging and more interesting also to work on.
Hello everyone, I'm Leena Wakankar. I head HR Infrastructure and CSR for ASK Group, which is an asset and wealth management firm in India. For me personally, wellness really has various aspects to it. And it means that physically being fit and proactive as far as taking care of yourself as an individual as well as of your family. Second aspect is financially being prepared for emergencies, managing your finances accordingly. And being an investment firm, it is very important that how do you manage your money to take care of the emergencies that arise suddenly. And also in terms of mental well-being, whether we have a work-life balance, whether we are having a life beyond work, we are having to spend time with our families is also a critical aspect. And at ASK Group, we promote all of this together, and we are trying to help our employees and support them in every possible way to maintain a physical well-being, a financial well-being, as well as a mental well-being. Thank you.
Hi, this is Srinivas Vedula. I manage total awards for Micron India and EMEA. We at Micron firmly believe that our well-being for employees should be centered around their needs and aspirations. So whenever we think of any new program around wellness, we reach out to them, we do surveys, we do focus group discussions, we have employee resource groups. Essentially, we wanted to listen to them, understand the needs of the customer, and we go back to our well-being partners and then create a charter how we want to drive the wellness programs. However we build the world-class well-being programs, what I firmly believe is that understanding the psyche, understand the behaviors, the emotion part of employee is quintessential for the success of the program. So we constantly reimagine ourselves, how you are communicating, how you are promoting your programs to drive the behavioral changes.
I'm Prabdeep. I'm founder of StanPlus. StanPlus is India's largest emergency response company, and we work with multiple companies, hospitals and ecosystem partners to take care of their employees when in emergency. I think it's very important in today's world that we actively ask ourselves as company leaders, as good corporate citizens, on what we are doing to protect our employees in case of an emergency. Let's say a senior management accident happens. How's the company prepared to handle that eventuality? Or we recently heard about flooding in Bangalore. What if an employee of yours who's COVID positive is quarantining, is stuck in that flood? How do you as a company, being a good corporate citizen, take care of that eventuality? At StanPlus and through our partnership with Care, that's what we are building, and that's what we do for hundreds of companies on a daily basis. There is the healthcare in a company is divided into two parts. One is on the prevention and on the wellness side, and second is on the response and the reaction side. We are the leaders in response and reaction. I think it's very important, it's very pertinent that every company builds that from day one to take care of all their employees. As Indian economy grows, as companies become multi-site and go into more and more deeper into Bharat, it's very critical that we build out. So at StanPlus, we have our own assistance center, our own training academies in emergency, and our own ambulance system. So we are a complete sensing to response startup. We are currently present in 12 cities, but we are partnered with hundreds of companies for over 400 sites of theirs across the country. We handle about 15,000 emergencies on a monthly basis. This number is growing all the time, and we want Indians to start thinking of prevention of emergencies and reaction on emergencies. It's going to happen. We are growing older, our parents are growing older. It's going to happen. It's better that we prepare for it. It's better that as a company we prepare for it. And I'm super excited about building this because we are passionate about saving lives, and I'm glad that we do that on a daily basis. Thank you.
I am Dr. Deepak Deshpande, Senior Director with NTT Global Data Centers and Cloud Infrastructure India. About employee wellness, only this definition echoes in my mind that it has to be very comprehensive and holistic. Number one, physical, mental, spiritual, emotional. But that doesn't mean that HR can take a back seat. They have to do what they're supposed to do. All of this will make sense only when they are able to deliver what they are signed up for as a HR organization. Only then the objectives of wholesome wellness is achieved. Thank you.
Hi, I'm Rajesh Panik Sarkar. I lead talent for a large business of Deloitte in India. It's a pleasure to be here for this summit on wellness. And talking about wellness, what comes to my mind before wellness is this whole concept of well-being. And organizations today are increasingly investing in the well-being of an individual and also in the wellness of an individual. Now, wellness has two critical aspects to it: the financial wellness and the health and fitness related wellness. Now, while we are on this subject, I think what is important for an organization to see is that what is their employee value proposition towards its employees. And while every organization will have a different value proposition, I think one fundamental premise which most organizations can consider is how do they want to demonstrate care towards their employees. And as they evaluate this whole concept of how to demonstrate care, then I think the answers will reveal by themselves that under this umbrella of care, how do you look at well-being, how do you look at wellness, and how do you look at behaviors which should sort of foster a good well-being and a wellness kind of an ecosystem and an environment, and what are some of the service partners which could sort of chip in bringing and enabling a digital oriented wellness ecosystem. I'm at the summit and you're the hosting partner is Ekincare. I knew them from 2018. I think over the last 4 years and especially during the pandemic, they've done a phenomenal job in supporting organizations across the country in the area of wellness. And I think digital is one of their forte. So we need service partners like them. I would personally want my organization also to see how this can benefit the people. But I guess there is a lot of room. And as we look at the year ahead and the new normal, I would say there's so much for us to do, so much of responsibility upon us. And as HR professionals, it's upon us to make a difference. So on that note, thank you. It's been a pleasure to be here.
Hi, so I've been asked to talk about well-being and wellness and its importance in the employee life cycle and also for the organizations. So as we know, this is being called as the year of great resignation. So everybody is out there with the market is heating up and the opportunities are immense. But at the same time, the good organizations are always trying to retain their talent. And while topics like remuneration, topics like designations will always remain a challenge, and in that bargain, somebody will do better than you. There are other topics where we make employees feel cared for, and wellness and well-being is one such very important topic, because if we do care for the value of human life at work and do things that lead to it, then ultimately it creates a sense of belonging in them, and that is what leads to long-term retention. We at Siemens as well really use well-being and wellness through various interventions which are calibrated, futuristic, and focused towards specific people and specific segments of our employees, and using data and analytics, which help us to design those interventions. Ultimately, that's what creates a healthy workforce and a happy workforce. Of course, the goal always is that we create a well-being net which the employees use to be so mature in this topic that they can handle their own their health themselves. And that's probably the ultimate goal for any organization which cares for their employees. I really liked some of the topics, some of the speakers who spoke here at the Pulse event, and it was a very enriching experience. Thank you, ETHR Now, and also the organizers.
I'm Srikanth. I'm co-founder and CTO at EkinCare. We are into corporate health benefits. We aggregate all the health benefits ecosystem for an organization. When you look at health benefits today, right, everyone has different healthcare needs. Some need annual health checkups, some need doctor consultations. The healthcare ecosystem is vast. Not one single company cannot kind of cover everything. So it is, and although from an customer's perspective, it's important that he has the access, the benefit that he needs, right, depending on the situation he is in. So what we do is we kind of create a platform that kind of brings all this healthcare ecosystem, all the players within the ecosystem into single place, so that employees can have a unified, stitched customer experience. When we look at a lot of products today in the market, they tend to take a service-centric approach. What I mean by that is sometimes their goal is to sell lab tests, doctor consultations, or sell you medicines. Where we differ is we tend to take a product-centric approach. We keep the employee at the center, because ultimately what we want to get out of it is to create an impact, create a change for better in terms of health of an organization. And we kind of devise the entire product around that thinking, right? Be nudges about positive health behavior, or nudging about the right benefit at the right time. Everything is centered around the concept that creating health impact or changing health for the better is the main goal, ultimate goal.
Hi, I'm Kiran Kalakuntla. I'm the CEO and co-founder of EkinCare. Today is a big milestone for us. We launched our first ever customer summit called Pulse 2022. One of the most important questions that we got today asked by one of our customers and one of the prospects is how EkinCare is better than the point solutions that they are able to work with within the companies, right? So some are using teleconsultation through a vendor, care management through another vendor, or health checkups through another vendor, right? The difference is working with a point-based solutions, what happens is the data is stored in silos. You don't get the mind share of the employees because they're now split between multiple call to actions. And then the most of the HR fraternity or the comp and ben managers are not built to manage the expenses across multiple vendors or partners. And this becomes even more difficult, especially in the new normal when employees are spread across multiple locations, multiple cities, right? How do you provide a unified solution to these employees irrespective of where they're working from, right? And when you have all these siloed point-based solutions, right? It doesn't look like a cohesive strategy. And that is where platforms like Care plays a big part, where we consolidate the network in the backend. We give you the accessibility, affordability across all the service providers, and more importantly, the big benefit is one platform, one call to action for your employees, one invoice, one escalation point, and all the data is coming back together on one platform so that you can build a more cohesive well-being strategy that cuts across locations, that cuts across grades, that cuts across employees.
Hello, I'm Chaitanya Chintalpati and I head the customer success team at Care. Health and wellness is very personal to each and every employee, and when a corporate takes up the responsibility of running it for the employee, it is a whole new ballgame together, right? With Care, we've been able to disrupt the market in terms of helping the employees or the corporates run the health and wellness benefits for them in 30,000 different configurable ways, right? This has been something that the corporates have never thought of, but have been amazed. We serve multiple corporates of various employee sizes, right from 10 employees to 50,000 employees. And everybody has a different expectation from a platform like ours. We've been able to successfully deliver their expectations by defining the success metrics that they would expect from this partnership. With an NPS score of more than 75, we have been establishing ourselves as one of the best in the industry and helping the corporates realize their health and wellness goals.
Hello, I'm Dr. Noel Coutinho, co-founder and chief business officer at Care. With 2.5 years of experience in the health and wellness space, I thought it was time that I gave back to industry in terms of how employees and HR could have a simplified way of making life a lot more healthy and accessible in terms of being well. For us, the dream was about making health and wellness a byproduct of the lives that we live, as compared to working in terms of saying, we need to be healthy in terms of a silo. Everything that we do at Care is about doing the heavy lifting to make sure that employees and HR understand health risk and take measures in terms of how employee health can be more improved, better measured, and more satisfying in terms of how people go about their work lives.